And this is really all of our forums, not been in the legislature for a long time, but has been a real champion on these. In April, also really cares deeply about it. Anyways, I'm not going to prattle on and filibuster. I just wanted to say one thank you for coming and moment, but first, Jackson, Representative Gilchrist.
Good evening. I'm just happy to be a part of this forum. I'm here to hear what you have to say, what your concerns and issues are. But I can say from personal experience, when my son was 7 years old, he developed a food allergy. It was milk protein at the time. And I remember thinking I had never heard of that and how to address that and to make his life manageable as he attended parties, went to school. I remember some of the hardships and also being very grateful. I lived in a community where there was a Whole Foods at the time because there were a lot of ingredients there that I could find and different products that I couldn't find in other places. But now I know that it seems to be more commonplace and more allergens than I have heard of in so many ways. Some people I know need EpiPens and things like that. Others don't. He didn't in his case. But it is a subject that I do know. And then I later had a child with 2 food allergies as well and how they've managed it over time. But I'm happy just to be here tonight to hear what your concerns are, what your different personal stories are as well. So I look forward to the discussion.
And good evening. I'm Jillian Gilchrist, and thank you, Senator Slapp and the panelists. I'm looking forward to the conversation. Personally, I have not experienced food allergy. I do have 2 young kids, though, so can imagine, and I've certainly have had their friends have food allergy. And so really, I think the best way to inform public policy is to learn from those who have experienced these things. And so I jumped at the opportunity to be here tonight to learn from all of you. And so with that, I'll stop talking so we can listen and learn. Thank you.
Great. So I'm going to introduce the 3 panelists, and then the thought is that they could each take, about 10 minutes or so, 5 to 10 minutes, whatever you're comfortable with, kind of, explaining kind of the challenges that you see, and you're each kind of experts in your own way, and then we could open up to questions. So you don't have to, unlike the public hearings that occur at the state capitol, where you have to sit for hours and hours before you get a chance to talk. This is not going to be how that runs. And Representative Gilchrist actually has some good ideas to change that at the capitol too. So, but that's another meeting. So anyway, Dr. Kristen Stowers is the assistant professor of health disparity at the University of Connecticut Department of Allied Health Sciences. And thank you very much for being here, Doctor. Of course. And then Alicia Wise is a West Hartford parent of a food allergy affected toddler and also a marking manager. Good to see you, Alicia. Thank you.
Nice to see you as well, Derek. Thank you.
Awesome. Yeah. And then Scott Zweig. And Scott, West Hartford parent of of a child affected by a food allergy, elementary school age, and an advocate for food allergy related legislation. We had the pleasure of working together and passing a piece of legislation that I think is or will help folks who have children with food allergies. And I'm sure Scott's going to talk a little bit more about that. And even though the legislation passed, there's still more work to do. So, but why don't we go back and start with Dr. Stowers, and you can maybe give us kind of the lay of the land about where things are in terms of food allergies, and we know more and more people are affected by them, right? And the level of acuity in some cases has been increasing. I'm kind of leading the witness a little bit, but I'll leave it at that. Thank you again very much for joining us.
Thank you. You guys can hear me okay? Yeah, so I'm so excited and humbled to be a part of today's conversation. I'm absolutely thrilled at the opportunity to learn, actually from all of you and your experiences in West Hartford. I'm here with sort of dual hats today. I am a researcher that looks at diet-related health inequities. I do not claim to be an expert in food allergies specifically, but I do study inequities in health and food among marginalized communities. And I'm also a mom of 2 kids, one who was experienced food allergies as a toddler. And I'll say that I think as getting ahead of myself a bit as we think about inequities and access to resources, when we discovered her food allergy at 1 and 2 years old, I was a graduate student and actually on WIC. And so I learned about navigating, being a mother and the challenges of taking care of a child with food allergies from the position of actually lacking resources first. And so I'm, in health equity in spaces, we always say sort of check your privilege. I acknowledge now, there are more resources at my disposal in terms of health insurance and even the neighborhood that we live in now. But I am coming to the topic recognizing the challenges that I faced with getting the right foods for my daughter on WIC. And actually, I'm also the wife of a Black man that has food allergies, and that's a totally different experience, just his sort of reluctance to getting diagnosed and treatment, and just this lack of trust with the medical community in general. And so, yes, so here in sort of a professional capacity, advocate capacity, but also very much from a personal standpoint as a mother and a wife. So I thought I'd share a little bit about the issue of food allergies and food allergy awareness from an equity lens. So I just wanted to flag some of the disparities and inequities, in this context. We know that low-income children disproportionately, sort of experience long-term hospitalizations compared to children from our higher economic backgrounds. Compared to non-Hispanic white children, Black children are at higher risk of developing food allergies. A recent study actually published just this year in 2019 documented that out of 38,000 children in the country, Black and Hispanic children were more burdened by food allergies, but also had higher emergency department visits as a result of it. More than 15% of school-aged children with food allergies have had a reaction in school, and among those kids, the first time needing the EpiPen was the first time that they knew that they even had the issue. And so that's just some of the disparities and inequities at the child level, right? At the adult level, at least 15% of patients with food allergies are diagnosed in adulthood, just to get back to just lack of even knowing that you have it and being concerned about what if it's too late. So I thought that I would sort of document some of those inequities and disparities in this context, just so that we can have a conversation that thinks about folks that aren't here, marginalized communities, and as inclusive as a conversation as we can today. And just to flag too what an equity lens means. So some disparities in diet-related health outcomes are not rooted in social context. They're just sort of inherently differences in older and young children and their experiences or developmentally risk of having a food allergy. But the equity lens prompts us to think about to what extent social determinants, the social context, causes these disparities. And from a policy standpoint and advocacy standpoint, these preventable disparities are really the low-hanging fruits about what we can actually do something about. The other thing to note that, sort of coming out some of the resources from Center for Disease Control and the reports that they've shared on advancing health equity across topic areas, right? Because we see it in food allergies, we see it in obesity, we see it in diabetes, a variety of domains. There's sort of this caution, if you will, that whatever we do, to be very intentional and strategic to not cause more harm. Right, without being strategic about the policy systems and environmental strategies that we are doing and how they impact certain populations or how certain populations have access and some don't, we can mistakenly widen make the problem worse, and we don't want to do that, right? And so, that sounds like it sounds like it's very challenging to do, and so I offer the social determinants of health, and in this context, the social determinants of food allergies kinds of framework to help us think through what kind of social context should we be concerned about? What are the relationships? What are the feedback loops even between those social determinants? So I don't know, how familiar folks are with the term, so I'll just share, an overview of what those social determinants are, and then I'll go through with some examples of what those social determinants might mean in the context of food allergy, awareness and adverse reactions. So the social determinants of health include neighborhood context, they include education, health and health care, economic stability, and the neighborhood and built food environment, or a built environment. So communities, the structural, physical space and place of communities. So just to think through how these determinants and intervening in the context of food allergies by the determinants, how we might conceptualize avoiding widening disparities. So for the neighborhood and built environment, the issue of whole foods and access to those kinds of stores comes up immediately, right? And so that's actually the primary area of my research. I look at inequities in the built food retail environment and how they map onto disparities at all levels across the life course. So we can imagine that food shopping and food access complicates things for families shopping for kids with food allergies or for themselves, spouses, just people that they're caring for. I don't know how much folks are familiar with the term food swamps, but these are areas that are inundated with unhealthy food options, ultra-processed foods. And they're related to the food desert issue, but if you can imagine a neighborhood that is inundated with processed unhealthy food products, and you have a child with a food allergy, the cumulative burden on what to do and where to go and how to get the best food, it's just exacerbated, right? Because a lot of it is knowing what ingredients are in these products and how they're processed, and it just gets to be really unmanageable, in those kinds of environments. When you think about the brown bag carryout places and the fast food, you're not sure what things are mixing where, and so that you can imagine families in those type of environments facing additional burden navigating a family member with food allergies. Thinking about economic stability, I actually, learned a lot more about the topic of food allergies from the context of food pantry clients and the work that I do in Hartford, Bridgeport, and Cheshire. Again, just thinking about how if you're food insecure and you also have a food allergy or a child with a food allergy, how that becomes particularly challenging. The food banking system historically was not meant to tailor to the needs of the clients in that regard. Now we're having more conversations in partnership with folks like Food Share and Connecticut Food Bank, and at the national level, Feeding America, people are having these conversations on how can the system be more conducive to actual needs, nutrition, but also food safety and health. So that's happening, but when I work with food pantry clients in 2016 to 2018, we heard folks saying, I have this allergy, I have this sensitivity, I have this recommendation from my doctor to eat in a certain way, and I cannot do it because I do not have access to food, and I can only get what is available in the pantries, however many times a week they allow me to come. So just to think about those kinds of populations and what it would mean to have the cumulative burden of food allergy and food insecurity. The other social determinant that I wanted to talk about is the health and healthcare system, right? We have lots of conversations about access to healthcare, insurance, right? And we can think about access in a variety of ways. It can be literally the distance or physical presence of clinics or hospitals, right, that can help folks with prevention and screenings, and if something goes wrong, treatment, right? Response to adverse reactions, but we know geographically these clinics and hospitals there are disparities there to begin with, and we know that there are disparities in insurance status and the ability to access these resources on the prevention side or treatment side. And so that's an important thing as we think about what to do and moving forward, just to flag. The other social determinant that I want to talk about is the social context and community context. We know for marginalized populations, like immigrant populations, who are experiencing a chilling effect connected to the political climate and the policies and conversations that are happening, right? So we have an entire segment of the population that is fearful of connecting with the education system and the health system and social systems for food, for any resource really, right? So as we think about how to respond and how to support folks, how do we access folks that are literally fearful of connecting with these systems that can give them the education or awareness or treatment, if you will. I know that in the food pantries, that's one thing we heard from pantry directors, that families that were foreign-born or immigrant status, they were coming regularly, once and twice a week. And then with changes in the administration and just, we all see it in the media, these conversations, they no longer saw those families. So we don't have a reason to believe that their food insecurity status changed that abruptly, but we just know that there are some chilling effects happening, and to be mindful about, how we can access those populations moving forward. And then the last thing I'll share is in terms of the education social determinant, school settings, particularly when we're talking about small kids, infants, toddlers, even school-age children. There are lots of conversations about food allergies and awareness in that setting. And so just thinking about, differences in the child care spaces and school spaces where there is school lunch, where there are those sort of important contextual points. And I raise that because, again, as a mother of a child who experienced allergies to cow's milk and then later different types of food products, I think the intention was, was always there to support, but there are these administrative things that can get in the way. How can we best streamline for parents reporting that my child has a concern and making those connections between doctor and school lunch director, right? It eventually happened, right? But I just really found myself, even as a pretty, well-informed, educated person, just really struggling. So how can we make those systems really more accommodating to those issues? And then the last thing, implementation, resources for implementing some of the sort of state level legislation from the past, but whatever conversations would happen moving forward, that there are resources at the school level to support the implementation and enforcement of training, of standards, because really, having the policy passed is only part of the story. It can really fall apart if folks don't feel like they have the resources, funding, and staffing to sustain it. So with that, I'll end in there. Thank you for having me.
Good evening. My name is Alicia Wise. I am a local mother. I have two children. One is a 4-year-old. I also have an 18-month-old who has multiple food allergies. I am very much at the beginning of my journey in learning how this food allergy thing works and how to navigate the systems that he comes in contact with. So, I'll give you a little piece of my story, but I think what the doctor just gave us for her point of view from and her lens, I think it's important to hear my story with that lens of understanding the privilege that I have in the pieces of my story. So I just want to make sure everyone understands that I'm coming at this with a great deal of privilege in the access that I've had in learning about my son's food allergies. So my son is allergic to peanuts, tree nuts, eggs, sesame, and he has a dairy intolerance. So as you can imagine, there are a lot of foods that we have to avoid. We learned about his allergies because the first 6 months of his life, he was suffering with really severe eczema. His eczema was so bad that he got MRSA twice. Our whole family got it at one point. So that was really fun. And if you ever have that challenge, please call me, because it is not fun and you really need somebody to kind of talk you through that. So once the pediatrician saw the severity of his eczema and understood that there is some correlation between eczema and allergies and asthma, we were tested for allergies from a blood test, and the biggest marker we saw was for tree nuts. So his cashew number was off the charts. So we went and saw a local allergist and had a skin prick test, which is kind of the next step. Once you have the blood test, you get a skin prick test. And he had these enormous welts for every tree nut under the sun, peanuts, and egg. So we were given our EpiPen, sent along our way, and figured, okay, these are in the top 8. We can figure it out. I can learn to cook without eggs. No big deal. So again, went along our merry way, and the Saturday before Mother's Day, of all days, we were having our usual Saturday afternoon lunch of pita and hummus and cucumbers and carrots. And all of a sudden, he just started screaming. So, he's a toddler, he's a little tot, pick him up, wipe his face off, and he was covered with welts. So luckily, we had already had a diagnosis for other allergens, and we kind of knew what to look for those particular allergens. So I just said, I'm not going to mess around here. I'm just going to give him the EpiPen and drive to CCMC. Like, it's pretty clear to me that something is not right here. So we went to CCMC, and he was treated, given a steroid, so he wouldn't have a biphasic reaction, which is, a lot of people hear about the anaphylactic reaction, but there's often, even when you treat with EpiPens, there's often kind of a second phase to the reaction that can be even worse, and that can be when their throats close up and when they lose the ability to breathe. So luckily we had access to that great facility for our son, and then went back to the allergist and confirmed that his sesame allergy is the most severe of his allergies. The challenge with sesame in particular is that it's not one of the top 8 allergens, right? So I can't name them all. I always miss like finfish or gluten or something, but there are 8 allergens that the FDA labels food for. And sesame is not one of them. And one of the biggest challenges with sesame in particular is that some labels can kind of hide it in spices or flavors. So whenever you're buying a product, there's no guarantee that sesame is not in it. You're constantly calling different companies to make sure that either they label for sesame or this particular product doesn't contain sesame. So it's definitely a second job, calling and making sure that most of his food can be safe for him. The other kind of part of that job is making a lot of food fresh, because that's really the safest thing that I can give him. Another challenge about having a toddler in particular with food allergies is that he doesn't have language. So, often with a food allergy, there's a first hint of something I ate wasn't okay. He does not have the ability to tell me that. So anytime I'm feeding him a new food, there's just so much anxiety for everyone in our household about, is this going to be okay for him? Or knowing that sesame and other seeds can have cross-reactivity in terms of allergens. It's really scary if something has flax in it. Like, do we play the Russian roulette, or do we just kind of avoid it until he's a little bit older and we can have kind of more testing or more opportunity for oral tests in the doctor's office or food challenges. So that is a huge concern of mine, is the food labeling system. And I do know that in Canada and in the European Union there is much more allergens that are represented on food labels. And I would love if here in the U.S. we could get to that level where we have just a lot more knowledge of what's in the food that we are buying in the grocery store. I'm not looking for, any given bread company to stop putting sesame seed in their breads. That's up to them, and I loved sesame seed until my son had a reaction to it. So, that's their prerogative. I just want to have the line of sight to know that whatever I'm purchasing for my son and for my family isn't going to hurt them and isn't going to make them sick. And I think that, when I think about, those food deserts or those food swamps, I have the ability to go 5-6 different grocery stores within a couple of miles of my house and kind of find that perfect product when I need it. But if you're living in a community where you potentially only have one grocery store or one place to shop for miles and miles, you do not have that luxury of going someplace else to buy the foods that are safe for your family. So I think one of my biggest concerns and one of my biggest passions is, just having that line of sight and that clarity to what is in our food products. I think it just makes for a more educated and a safer community. And, we are hopeful that maybe Gabe will grow out a couple of these allergies, but I don't think that now that I've kind of learned the very tip of the iceberg about what it's like to experience these food allergies, I don't think you can never unlearn this, right? You can never back away from this experience of your child having such a severe reaction to something that he ate and not continuing to feel passionate about making it just better for other kids like him and other members of the community that are also challenged with food allergies. So, thank you for having me.
Okay, guess that leaves me. I'm Scott Zweig, and I am also not an expert. I'm just a dad who loves his kids, and I live in West Hartford. But we too have an experience with a food allergy. We have 4 children. Our eldest, Ava, she's now 7, was diagnosed in December of 2017 with a tree nut allergy. One day before Christmas, she had a cookie, and she started, scraping her tongue and was rashy, was complaining about, gastrointestinal discomfort, and we had no idea that it was an allergic reaction. In fact, I'll admit we were totally uninformed and uneducated, and we're lucky that it wasn't lethal because we were not ready for what we later learned was a severe tree nut allergy. Not peanuts, cashews, walnuts, pecans, pistachios are the top on her list. It was an accident, and because we didn't know, we weren't prepared, but it's totally changed our life. And I think all the parents on this panel and in this room can probably attest to the fact that when you learn someone in your family has a tree nut, peanut, shellfish, dairy, soy, milk, egg allergy, the whole world changes. What you could eat yesterday with no fear all of a sudden creates tremendous anxiety. And that's what we feel every day, anxiety, because we're not sure. Is it labeled properly? Was there cross-contamination? So I'm going to get to that. But we've adjusted, and like Alicia, we are also lucky to have resources. And we can get the care that we need, and we have great insurance through my employer. And my wonderful wife, who's sitting back there, spends a lot of time shopping and making safe foods and calling manufacturers day and night to know, does this English muffin share a line with a facility with a place that uses these allergens, these tree nuts. And without the ability to do those things, we'd be in a much different situation, in the disparate situations that Dr. Stowers was describing. And because we're lucky, I want to make sure that we're not the only ones who have those accesses and resources. So it's important to me that everybody be given an opportunity to be safe and be protected. I don't want any child, no matter what color, what city, what state they're from, to feel uncomfortable or anxious going to school and getting lunch, or going to a birthday party and getting a cupcake or pizza or ice cream. I mean, I wouldn't think twice 3 years ago stopping on the side of the road and getting ice cream at any ice cream shop in the whole country. But now I think twice, 3 times. Is there pistachios, walnut, pralines? Did they wash the spoons? And, some facilities say, we have a special, room in the back where we keep the, allergy-free ice cream, the dairy-free ice cream, or the nut-free ice cream, and we have new clean utensils and gloves. And some places say, we don't have nuts. I'll wash the scooper. But the level of awareness, education, and concern is alarming to me. So the reason we got involved is because there was a bill being proposed in 2018 that was going to hopefully require school bus drivers in Connecticut to be trained on recognizing anaphylaxis, something I was not trained to do, and what to do when that happens. Administer epinephrine, for example. Call 911, for example. And also allow children to carry their own medicine on their persons in school, even if they were too young to administer themselves, which was previously prohibited. And also update our, I'll be generous and say, out-of-date guidelines for the scientific and medical standards of today that the Connecticut State Department of Education currently uses and relies on for these allergens. They're 20, 30 years old. They need to be current. There's been advances in medicine and science, and we're behind the scenes. We're up behind the times. So I worked with some other advocate parents. I see one in the room today. And our senators and our representatives. And Derek, at the time, was our rep, and he was all for it. He was an advocate, got behind us. He helped us pass this bill in the House, and then it came to the Senate, where it was touch and go there for a minute, but it ultimately got adopted on the consent calendar, and it was such a tremendous victory. I've never felt so proud of anything, short of maybe having my children, than getting this bill passed, because I, for a moment, thought that we had just made our state safer for our children. And it was a tremendous sense of relief. But like Derek said, the work's not over. We passed the bill, but is it being enforced? Is the training happening? Are the guidelines being updated? Are schools allowing children to carry their medication? Or do we have to handhold every district in the state? Now, I can't talk for every district in the state, but I live here, so I focus on here. And I think there's still work to be done here in West Hartford. I mean, the schools say the hot lunches are free from peanuts and tree nuts. I can't speak for the other allergens. I imagine they're not. But they also serve peanut butter in every cafeteria in this town as like a backup lunch. So, okay, what about cross-contamination? And my wife called the school the nutrition health food person, and he didn't know cross-contamination from the Cross Bronx Expressway. It was very disturbing that they didn't realize that just because you don't have a cashew or a peanut in this dish doesn't mean it can't be on the napkins, the plates, the utensils, the trays, or through the air. And so we need to educate. And it starts at home, educate our families and our friends, and then we have to just expand. And we're going to try to, educate the towns and the cities in Connecticut to be more up to date on cross-contamination, on the 8 allergens, on the other 100 allergens that aren't listed on all the big lists, to make sure that people aren't being marginalized in schools, no matter their educational background or their economic status. Because, my daughter, she goes to a birthday party, and she's very shy. And we always send her with her own cupcake or her own cookie. But all the kids are having ice cream cake or having the pink frosting cake, and she's got her own little... And she feels marginalized, embarrassed, and I don't want her to feel that way. I want her to be confident and that it's safe, but I don't know if that food is safe. And if everyone else was aware that there's a student in the classroom that has this condition, we'll be more accepting of each other. And that's the kind of thing we have to preach and promote: education, awareness, knowledge. And it starts here, starts at this small group level, because we can tell our neighbors and our families and our friends and our representatives and our legislators and our senators, and together we can make a difference. The bill that we worked on, House Bill 5452, it took years before it eventually got adopted. And that's because, I don't know why, but the more people we added to the grassroots effort, the more momentum we got, the more senators we bothered and lobbied and emailed and called and left voicemails, the more traction we got. And we just have to keep fighting for what's important. And whether it's providing health care to those who are underprivileged, or making food accessible to those in food pantries, or whether it's expanding the allergen list to cover sesame and other top allergies that are just below the top 8. We need to do all we can as a community together to make a change, because we can be a vehicle of change if we are united. Because 1, 2 people, maybe you can't make a difference, but when 25 people show up at the Senate floor and say, "Hey, we need this to happen now," they start to listen. And when 25 becomes 200, becomes 300, becomes 5,000, we write letters, we get on TV, we write petitions. They can't ignore us anymore. So I'm getting all fired up here, because I didn't know anything about this issue before I got involved. But I heard my wife talking to another mom about a public comment period at the Capitol last March. And they said, "Hey, can you speak?" My wife said, "No, I can't speak. I have 2 children under the age of 2. I can't take them with me all day and wait around for my seat." But I said, "Hey, I'll go. I'm available. I work downtown." So I showed up, and I wrote this speech, and I was all prepared to be stoic and confident, dad, lawyer, tough guy. I didn't last 3 seconds. I totally fell apart. I was a mess, because it became real that my daughter, who I care so much about, could essentially die over a cashew, and that people didn't know that, and people might not care. And her bus driver had no clue, and her teachers might not be able to get epinephrine in time. I mean, before this bill got passed, your epinephrine had to be stored at the nurse's office in a locked cabinet. So what if Mrs. Smith, the nurse, is at the gym because Johnny broke a toe or had a bloody nose, and you have an allergic reaction in room 305? What do? You can't wait. Every second counts. So having the ability to have a child either wear it on their, a waistband or a fanny pack, or have it in their backpack or in their locker, it makes it that much more accessible. It could save a life. And this time between school and home was a 15, 20-minute time where, it was a gray zone. Was she safe? I know you can't eat on the bus, but kids eat on the bus. They don't listen to the bus drivers. And I heard a terrible story in Georgia about a young woman, high school student, who ate a bite of a granola bar that she'd previously eaten before that she thought was safe, had a reaction, and she didn't have an epinephrine pen. And the bus driver didn't know what to do. And they drove to the nearest school, and they called 911, and the EMTs came, but it was too late. And this young woman passed away. And that was because they weren't prepared. They weren't ready. They weren't educated. They weren't aware. And we can't have that happen in 2019, 2020, and beyond. We have such technology. We have such resources, such awareness, such information. We got doctors. We got lawyers. We got parents. Together, we can make this work. We just have to be mindful that we can't take no for an answer. And we have to know what we want. We have to fight for it. And we did that last year. And Derek and Tricia and my wife and Jessica and others, we fought for it, and we got one bill passed. But that's just one bill of many that we need to work on to get schools and legislators and educators aware of this growing concern, so they start taking it seriously. And I don't know how long I went or how much time I have, so I'm just going to stop there. So some things I want to do. I want to expand the list of the top allergens to include sesame. And I don't know what the 9th is and 10th is, but we should probably get some of those top 10, 15 on there. Mustard seeds. Okay, let's do mustard seeds too. Because there's no it's such arbitrary. The top 8? How about the top 4, the top 12? I mean, the prevalence of allergies is growing so much. I heard yesterday 32 million Americans have a food allergy. 1 in 13 children. I mean, that's neighbors, that's friends, that's the person maybe next to you right now. Why should we not be caring about the sesame allergy? So that's going to take more than just Connecticut, West Hartford parents getting together. But if we band together and start making moves, they'll have to listen. There's certain exempt. So the Food Labeling Act is called the Food Consumption, FALCPA or something like that. It has these exemptions for shampoos and toothpaste and shaving cream, where they don't have to label their contaminants. What if you have peanuts or cashews or coconut or soy or egg in your shampoo? I mean, that could cause a reaction in a toothbrush, in a toothpaste. So I don't understand why those exemptions exist. Probably some expensive lobbyists on the retail side. We need to do away with those exemptions because those are putting kids at risk and adults at risk. And lastly, they're only required to food label if the ingredient is present in the food item. They're optional to mention cross-contamination, shared lines, shared facilities. I don't understand why we're not including that all under the same umbrella of important. Because cross-contamination, albeit less likely, could still be as lethal to any one of these number of allergens we were discussing today. So we got to take it one step further. Okay, we've learned in the last 10 years. Cross-contamination is a real thing. Just because they make peanuts on the left side of the building doesn't mean that the chocolate made on the right side doesn't have peanuts, through the air or through the facilities or the hands or the clothes of the workers. So we have to step up our game, I think, and demand our government, start with the state, start with the town, move to the state, move to the federal level, starts expanding the scope of these protections to help us be safe. Because nobody wants to read a story about a kid in West Hartford or Berlin or Bristol or Avon who dies of an inadvertent cross-contamination or reaction to an allergy that maybe isn't registered on the list of top 8. So if this is what we can do, have these meetings to get the conversation going, then I think we should keep doing it. And I encourage you to reach out to your neighbors and your friends and your representatives and get behind a bill or work on a new bill or ask questions of those people in your community who can help make a difference, because together I think we can be a vehicle of change. Thanks.
Wow, thank you to each and every one of you. I'm so inspired by your passion and also your dedication to not only, of course, helping your own children, but thinking about all children. And your optimism. You know, Winston Churchill, one of my favorite quotes, he says, "I am an optimist. I don't see much use to be anything else." And that was during the Blitz, you know, and he was still an optimist. So anyway, all right, let's open it up. The only request I would have is that if there are questions or things about other than food allergies, maybe we could do those offline in terms of if anybody wants to talk about tolls as an example or something else. So plenty of opportunity to do that, but we want to just be respectful of people's time, and we have these great experts here. So, you know, just fire away, and if you have a question, Colleen, go ahead and you can just ask the panel directly, and then obviously, guys, if you want to jump in at any point.
I want to address the comment about food pantries, because I've tried to donate gluten-free things to my local food pantry. And then when I've talked to people who work in the food pantry later on, they don't have a separate section for food allergies. So apparently the pantry does get people who ask for gluten-free, but they have no way, they don't track it, or they don't, because I've asked, you know, well, how many families have you got so that I can, you know, give enough so that everyone at least has a piece of, you know, gluten-free bread. Because it's, you know, just reading about the inequality and the things that are available at food pantries. It's mostly pasta and peanut butter, and, you know, it's just, I mean, what you do. There's, yeah, there really has to be better standards of labeling, and better, the other thing that I avoid in the grocery stores, I avoid the bulk bins and the bulk sections, because you don't know what's happened. You don't know if someone's, you know, filled the flour bin before they filled the, you know, rice bin or what have you. So there's all of these potentials for contamination. And it just, you know, it makes you want to, you know, come home and wash your groceries. And it's, you know, I mean, we need training on every level. We need training for restaurants. You know, I don't go out to eat anymore, really, because ever since I sat down in a nice restaurant and had a waiter tell me I could have the farro, which is, you know, a wheat grain, and I'm sitting there going, okay, no, I can't. There's a level, we need more overall education in everyone who works with food and with allergens, and on all levels, I think.
We're good. We got this one on. So.
Yeah, go ahead. Do you need, you're all set? Do you need a mic or no?
No, you can speak. This will pick it up for
I
you.
just have a quick question. So the legislation that bus drivers are trained to administer epinephrine, is that active right now? Like if I ask my son's bus driver if she's trained, her answer will be yes?
And if it's not, you should call the bus company, and you should probably call, I don't know, maybe me, and we can talk to them about that. That was effective July 1st of this year.
Of this year,
It went
okay.
into effect July 1st of last year, but the mandatory training requirement was effective July 1st of this year, before the start of the school year. Every bus company was supposed to train every bus driver on how to recognize anaphylaxis and how to administer epinephrine. They don't have to do it, but they know how. They're supposed to be trained to know how.
What district do you live in? Are you West Hartford?
I'm West Hartford, Northfelt Elementary School.
His
And
first
I'm
student,
asking,
the bus company?
sorry?
His first student?
First student, yeah. I will just tell you, when my son was starting kindergarten, he's in 4th grade now, I brought in a food allergy advocate, and talk about having privilege. I'm very grateful. I had to spend $4,000 to bring in a specialist to fight for the bus. And at the time, I was told the protocol is they will call dispatch.
Yeah.
Dispatch will call an ambulance.
Pull over.
Ambulance will find my son, and I said he will be dead. That is ridiculous, and I don't understand why it's not an extension of school. And it was a big argument, and our compromise was, because food allergies are considered a disability under the ADA, that he can take the bus as a student with special needs. So the compromise was he was then put on a smaller bus for children with special needs that had a monitor, so at least the monitor could recognize if he was going into anaphylaxis, and at least monitor other kids not eating, and then we were going to be left with that, and which wasn't a great compromise, but it was something. And so I'm so happy this bill is passed, because it's never been a good feeling to know that that's it.
Can I just double back really quickly to the comment the woman made about pantries, and what I heard was the sort of the disconnect that we actually see in our work in Hartford, Bridgeport, just a variety of places across the country where there's a disconnect between the leadership in the system, food pantry directors included, and the clients. So when you talk to the clients, they say that we need these items to accommodate our family's needs. When you separately talk to, say, pantry directors, as well intended they are, it's a volunteer, based system, right? So everyone's sort of there, and not to be critical, but with the warm glow of I'm serving, I'm donating, I'm working with folks. But we really do see that the perception that any food is okay food if you don't have any food, and beggars can't be choosers, and these kinds of things, going beyond just sort of these unfortunate attitudes toward food insecure populations or folks experiencing food insecure, and I would add very severe food insecurity, because this is after SNAP runs out, folks that are needing to still feed themselves for the rest of the month, right? So it's an unfortunate attitude that comes out of everyone being really afraid, if you will, of the scarcity, lack of food. Open up the pantry, there's no foods there, and you see this manifesting, and so you hear them say, why would we have this section? Beggars can't be choosers. How bad could the allergy be? And isn't just feeding a hungry belly better than anything, right? And so just to sort of add, I wanted to double back to that, because it's important as we think about the anxieties that we all feel being parents of children that experience this, and imagine the dual burden of I have anxiety about feeding the child to begin with, and I also have anxiety about this concern.
So about the school bus. So I talked to the bus driver tomorrow.
Well, I just want to thank you. Basically, my bottom line was to thank you, because I know not everybody has the resources to hire a very expensive advocate and get the compromise that I did.
Oh, we didn't have any money.
No,
We
I'm
just
saying
put in,
general.
yeah.
Thank you.
Oh, at your school. Yeah, it was a bunch of parents, and Derek and Andy Fleischman and Beth Bai, and we got momentum. At first, it was just 3 parents. And then we added a rep here, sent her to there, and next thing you know, we're on the consent calendar and we're celebrating. But yeah, I walked onto the school bus the first day of school, right behind my daughter. And I said to Frank, hello, Frank, I'm Scott, I'm Ava's father. She's got a food allergy, tree nuts, cashews, walnuts. This is where I pointed to her backpack, little special pocket, said, this is where it is. She was so embarrassed. She went to her seat. I said, are you trained? He was like, yeah, we took the EpiPen training. I wasn't totally confident, so I called the first student. And they confirmed that my bus driver had taken the training and he had passed. So every now and then I talk to him just to remind him who I am, who my daughter is. That there's putting a face to it really helps. And he can also carry his epinephrine in school.
He does. He wears a spy belt. He's been since kindergarten, and they never gave me a problem with that.
That's good, because some school districts give kids problems. I know that happens around Connecticut, so I'm glad that he doesn't have those problems. Hey, but when you make noise, when we make noise, things happen.
Yes. So thank you.
It's my pleasure.
And as for food pantry, I just want to say, every single time I get any kind of information about donating to a food pantry, it never says peanut butter substitutes or something. It would be really nice if it did, because I've gone in and gone down the list, but I do buy Wow Butter or something also because I know. But people who don't know, just go by the list. It'd be nice if they added it to the list.
Yeah, and I think the unfortunate thing too is understanding that there are layers of privilege in that system, and so being experiencing hunger and being food insecure for some folks is they struggle with that emotionally and mentally, and it's a population that in some towns right here in Connecticut, they're sort of protected from even having other residents see them in the food pantry, right? And so that's why the disconnect between sort of those in power who are the ones writing those kinds of announcements, not the clients themselves, is an unfortunate one, because they're representing the need and they don't connect with the true need. And unfortunately, there's the stigma around food allergies, there's a stigma around food insecurity, and those things really get in the way of policy and practice. They're not the ones asking for the foods themselves, yeah.
Either one.
Go ahead. Okay. I have a son who's 5.5 now who had a full-on anaphylactic reaction with the first bit of peanut butter. Tried at home. Next kids will try peanut butter in the hospital parking lot to avoid the whole ambulance ride and everything. So learned the hard way. We have been very fortunate that he goes to school at a magnet school in Hartford that's peanut and tree nut free. So school has been a safe environment for us. His teachers have been wonderfully receptive, signs on the door, no outside food allowed for parties, no food. So I feel very fortunate that he's in this safe environment. But I'm curious if we were to ever switch to West Hartford Public Schools, how parents feel is it like the peanut-free table in the lunchroom? Yeah. And like I always am curious to know how kids feel kind of being designated to sit at the peanut-free table, because we don't experience that because he's lucky that that's not in the lunchroom in his school.
They feel marginalized.
Yeah.
I mean, you're lucky if you have a classmate who you're friendly with, who you can, be a teammate with. But my daughter sits with the same boy every year because they have nut allergies. Now, other kids sometimes sit with them. The teacher in second grade encourages the students to bring in what they call a safe lunch, so they can sit with the kids with the allergies, which is a nice sort of community thing. But yeah, I mean, special table, and I imagine that makes her feel quite marginalized.
I wonder, is that like a mandate, or can you choose to sit with the other kids and kind of sit at because I know like in some, like on support groups, they say like my child will choose to sit with everybody, she just sits like at the end of the table, but in West Hartford, is it that you have to sit at the...
No, you don't have to.
Okay.
But I think the teachers all know who the kids with the allergies are, and they rotate who's sitting, and they try to put the kids with those related or similar allergies together. That's.
I just want to speak up to this one point too. Is I do get, and again, my kid's only 18 months. I am not in the school system yet. I have friends who have children with like sensory processing disorders and things like that. So sometimes some kids, like the only food that they can eat is peanut butter. So I just get, I do have a little bit of trepidation about kind of banning any food because, my child's allergen might be the only safe food another child can eat. So that, that's just kind of a point of conflict within myself because I haven't had to kind of meet that particular challenge head on. So it's just something, I think about, and I try not to think about the future for my son too much because it does give me a little bit of anxiety. I try to think about, okay, what's the next week of meals that we're going to eat at home? But I did want to bring that point up and also just kind of the social emotional side of, I think about my son a lot in terms of his allergens, kind of pivot in the story is my daughter actually tested really high for some of the same allergens when she was his age. And she had experience eating them and had never had a reaction. So it's really important in our house that we're not a peanut-free house. We're not a tree nut-free house. We're not a sesame-free house. My daughter has to eat those foods because we want to make sure she doesn't become allergic to them. So in our house, and again, this is not something that would be easy to replicate in the school system, so I totally acknowledge that. But in our house, the rule is that if Nora is eating a peanut butter sandwich, she eats it at the table, and she has to wash her hands immediately after, and she helps me to wipe the table afterwards. Because I'm trying to teach her to be really sensitive to her brother and compassionate to her brother's condition, but also to be an advocate because, hopefully someday they'll be in social interactions together, and she can, assist in helping him speak up. So I think that there's a lot more of that kind of work that can be done at the school level potentially, that we don't have to have full-on bans. But again, I think it's very dependent on the risks that a parent is willing to take. So, again, I acknowledge that that's kind of where I'm sitting in my experience today, and it might not be kind of shared, and it might change significantly once either of my children start kindergarten. So.
I think it's a really important point. I've found, and we're in Newington, so not in West Hartford, but still I have school-aged kids, and we the extent to which you can get kids to support one another and just sort of have those attitudes. It's not my diagnosis, but I care, and seeing the teachers at the beginning of the year, they acknowledge we have this allergy, and the kids just sort of, okay, Mom, remember, don't send that, or when we're there, we wipe off. And so I just think, beyond, just getting back to the emotional and the social and just community, it's a good thing that for kids to see that. And also, how can we get to that beyond peanuts too? Because, as was mentioned, sesame, some of the ones that are maybe not so, the ones that you don't typically hear about, my daughter's is relating to cow's milk, right? And so when she said that in the school line, it was actually a service person that's kind of like, oh, that was so funny. Like, why are you even saying cow's milk? But she was aware that's mommy says that for a reason. And so that is sort of not the most sensitive response, right? There's a reaction for everyone in line when there's like, oh, that's such a funny term, cow's milk, as opposed to what else? What other kind of milk is there, right? And so just, how in school settings, but beyond how people can really have a sense of ownership to our neighbor and brother's issues, even though it might not be in our own household.
So my younger son, he's allergic to peanuts and tree nuts and dairy and eggs and sesame. And sesame is by far the most challenging because it's not labeled, because we have to call everybody because it could be spices or natural flavors. A couple months ago, the state of Illinois actually unanimously passed some legislation requiring the labeling of sesame. Now, I have no idea how they're going to do that because I don't think all the Doritos in Illinois are produced in Illinois, so I have no idea how that's going to work out. But I love it, and it would be great if we were like Canada or the UK and had that labeling required here. Is there any legislation like the Illinois legislation being contemplated in Connecticut?
And I'll, my colleagues can jump in any moment. I haven't seen any yet. I am the brand new chair of the Children's Committee, and I'm happy to look at that next session. I would say that, you touched on a challenge sometimes that we have in Connecticut because we don't have a large market share like California or something, where California recently changed their requirements in terms of flame retardants in furniture, right? And they changed the entire market. The entire nation right now does, for the most part, doesn't put flame retardants in furniture anymore because California changed its law. Connecticut, we're small. That said, I worked on a GMO labeling bill a few years ago that we passed, bipartisan, and it was a great win. But and we had a trigger built into it. So because a lot of those same concerns were brought up, right, by the food manufacturers, and are we going to make special products just for Connecticut, et cetera. So we had in it that if so many states, certain population, et cetera, join in, then our law goes into effect. It's not perfect, but it does continue to kind of create momentum. And if enough states do that, I have to look at what Illinois does, but that's a strategy. Legislative strategy usually is you don't lead with that. You know what I mean? You go for the gusto, and if you have to negotiate it down, so be it. But anyways, let's talk more. And I mean, I'm very intrigued, and I'm sure, I don't know if you guys are.
Yeah, I find 8 is so arbitrary. I'm very intrigued to understand why they originally came to 8 and what it looks like in other countries and how we can start.
There's also some federal legislation. I just want to, if anyone is interested, there's federal legislation on the books. Please call your representative if you're here in West Hartford, Representative Larson, to ask him to co-sponsor that, and I can send any information on that.
And if I could just say one thing that is as frustrating as it is not to have it broader with the labeling, I do think back about 16 years ago, they did not have these labels when my son had food allergies that impacted him so much. There was nothing there. So we've come some ways, and there's so much more work to do, but I feel heartened by the fact that I look up and go, wow, now it's much easier for me to shop for him than it was when he was younger. So I know there's a lot more to do, but just know there has been significant work done.
Really quick on your question, it's super easy. So over 90% of food allergy is accounted for by 8 food groups. So that's why that's the case. So it's milk, egg, wheat, soy, fish, shellfish, nuts, peanut, and tree nut. So there's really, although you can have any food allergy, over 90% are accounted for by those 8 foods. Now sesame is becoming a very top contender as the 9th one, and there is FDA input that you can, if you go to the FDA website, or I did post it a long time ago on Neighbor and Friends, you can put your own 2 cents in to add sesame to the labeling, and they are in that process of reevaluating adding a nut, that 9th. And really that will account for well over 90% of people's food allergy. The others are so varied that it's not worth, honestly, it's not worth labeling things. You just have to label everything, and ideally they should just label everything, but that may or may not happen. So
I know this one in the back. I apologize, my view has been blocked, so I haven't been able to be behind this podium, but please accept my apologies.
No, thank you very much. I had a question about the enactment of Senate Bill 706, and that was the stock epinephrine bill. And the reason I have an interest, and know about it by name and number, my son, who just turned 15, even though he looks like a grown man, has food allergies, and so I empathize with many of you who have toddlers who are going through that stage. I remember I was terrified when we had 2 anaphylactic episodes when he was a toddler, and there was a time when all he drank was Horizon's organic milk. But here he is at 15 strong playing football, so it's doable. So just, you have my empathy. But what happened is we went to the Capitol to testify about the budget as it related to school nurses in non-public schools, and him having attended private schools for most of his life, and a student at Northwest now, was concerned about the idea of removing school nurses, especially for children who had food allergies. So his testimony on that led him kind of through this convoluted path where we also submitted written testimony on the bill that later evolved into the stock entity bill, which is why I asked the question and have kind of a personal interest in knowing how that's progressing.
Yeah, that's a great question.
Who is on the Public Health Committee about this bill, and there seems to be some issues with the protocols of who is allowed to administer, and can an entity, if an entity designates a person, if it's the police officer in the Capitol building because he's a police officer, the wording on the protocols makes it, he has to be an EMT as well as a police officer, so there's some issues right now with the language that might have to be clarified. So I think there's some tweaks that need to be done, but an individual who is designated by an entity larger than 15 people can have someone get the epinephrine, and the problem is the cost, because I don't think right now that we have any insurance waiver for an entity to get it at a cheaper price. They would have to pay full retail to get that, unless you're...
I believe that Mylan, who makes brand name EpiPen, has a program that, at least for schools,
yeah, but it's
not for other entities. Yeah, But for schools, that all schools could get a stock of because otherwise you have to write a prescription for a patient, right, to get it in this country. It's not something you buy off the counter. So, so these would be non-scripted, non-specific, and they have a program. So for schools,
Right.
whether it's private or public, they should be able to get it.
And there were some issues with that because in Connecticut, you can't write a prescription to an inanimate object, so
Right.
I know the consumer department worked on that. So that's where it is right now.
And the question, does it have to be an auto injector? Isn't epinephrine and a needle really inexpensive?
You have to have you have to have expertise to use a syringe.
Right, but not an injector.
Not an auto injector. A couple of questions in terms of, especially what Connecticut can do and inequities, especially with respect to school lunches. I've been working in food allergy advocacy for several years at the legislature, and my own children, my oldest food allergy child is now in college. She's a freshman, and she's navigating the world of eating outside the home for the first time on her own every single meal. And she's got dairy, egg, peanut, and tree nut allergies, and she's 17 and working on this. And the difference between accessing food at the university level and K-12 is extremely different. It's much easier to eat safely at the university level than it is K-12. My children were never, and I have two of these allergic kiddos, they were never able to access lunch through the school program because we could never get enough information to know if food was safe or not for them, especially if you're a multi-FA child. And one of the big issues that we have as advocates and that we're trying to work on with the state is how do children in Title I schools and free and reduced lunch, they often are served food that is not safe for them. A lot of the school lunch providers do not abide by the USDA rules on feeding, special dietary meals. There are several operators in the state of Connecticut. When we did the task force on food allergies in schools, one of the operators said if a child has food allergies, they shouldn't even eat school lunch. And that's a civil rights infraction. So we need legislation in Connecticut that would require our school lunch providers to be trained in allergens, cross-contamination, and how to safely serve all of our children, especially those children who are on free reduced lunch. Just recently, if you've been watching the news in New Haven Public Schools, the students were served, because they're all free reduced lunch, one of the granola bars that may contain peanuts and tree nuts was served to everyone, whether they had allergies or not. The school district did a big mea culpa. They said, we'll take it off. We're not going to serve it again tomorrow. And they served it again the next day. So this is an issue that we would love to see addressed at the state level, that there be some sort of standards that are made for feeding our children.
That's a great idea, and this is exactly why we're having this forum. We've got a lot of great ideas, I think, for potential legislation next session. We do want to be respectful of everybody's time. We had 7:30 as a goal to finish up. Doesn't mean we can't have side conversations or whatever after, but I know, people want to get home too. So, I don't know, does anybody have any final thoughts, words of wisdom, or anything you all want to share? Anybody, go ahead.
Yeah, I just want to say thank you, and I look forward to continuing the conversation.
Yes, thank you so much for having me. I learned so much from you all.
And tell your friends, Tell your friends that there's people in our district who care about people with food allergies, and that if with a phone call or an email or a meeting, we can start making changes right here at this level. We did it last year. 0 legislative experience. We passed a bill. So, if I can do it, anybody can do it, right?
And I just want to say thank you for including me. I think anyone kind of new to food allergies can sometimes feel like it's a very isolating place. So I'm really happy to find community here with all of you. So thank you.
Great. And just last thing I'll say is there is a email sign-up sheet, not only for me, but we'll make sure that I know both Representative Exum and Gilchrist have e-newsletters as well, right? So if you want to, no pressure. I know you probably already get a ton of emails, but if you do want to get legislative updates, you can sign up over there. Contact information is over there too. And thank you. And we will follow up. And hopefully this is the beginning of a great dialogue. So thank you again for coming out.